we had a case of a drug called chlorhexidine that was, you know, people mistook it for an eye drop. It was supposed to treat the umbilical cord of babies, and they applied this drug to the eyes of their children up in the north, and Yobe State, Adamawa State, and the children became blind. Couldn't that have been avoided? And why did they do such a thing anyway?
I certainly agree with you that this could have been avoided. But we have structures in this country, and I think that we'll have a part of this blame. I do not see why these children would have been subjected, innocent children, to not born blind, and now they are blind. But what has happened is that chlorhexidine is a disinfectant and also an antiseptic agent, which commonly you can use to clean up the umbilical cord. It's used in toothpaste, it's used in the mouthwash, it's even put in some creams. A little of it can even be used to preserve eye drops. We use it in a very minute manner, 0.0 something something, to preserve some eye drops so that bacteria cannot go in there. So chlorhexidine is a very powerful antiseptic and disinfectant, which can kill bacteria, can retard the growth of bacteria. So I think that the system must have been very defective, so that a pharmacist never saw those things when they were brought. And if he did, this couldn't have arisen, because the job of the pharmacist is to label. He will label those bottles and ensure that till the point of delivery to those children is such that it's written strictly for external use. Because for those things to clean the umbilical cord, it's not to be taken by mouth or to be dropped in the eye, because it must be a high concentrate of the chlorhexidine. Which I've told you, chlorhexidine has bactericidal, it can kill bacteria, it can retard the growth of bacteria. So it works powerfully well, even though we see it as a simple antiseptic or disinfectant. But it goes beyond that. Even in surgery it's used, in O&D it's used. So as I said, it's something that we need to go back to the basics. I think we have recommended over time, even when I was president of my society, to government that at every level of care, a pharmacist should be in charge. Even in all primary health care, put one pharmacist there to oversee before you give to the attendant or the nurses to go and dispense. Otherwise, we won't see this kind of thing happening. And the National Drug Policy prescribed, which a document that was made by WHO, EU, and Federal Ministry of Health. This document was again revised during the particular minister about 5 years ago, and it says that at every level where drugs are used, let a pharmacist oversee it. So
it's in the law already.
So it's there in the law, but this is not obeyed. And I think we have ourselves to blame, because if a pharmacist was there, for now, we will be talking of prosecuting that pharmacist that he will never practice. But I'm sure that a pharmacist never saw any of these things. And I think that goes by, we must go back to the law and ensure that things are done properly in this country. And that drugs cannot just be given to people as ordinary commodities, because they can harm life. You can imagine children now that were not born blind, they are now blind, causing an irreversible damage to them. So I think this could have been avoided.
Do you think part of the problem was that the drug was packaged in a certain way? It actually looked like an eye drop.
Yes, but you see,
are there regulations for such things?
Yes, there are regulations. You see, during a particular minister's time, when drugs are donated, there is a policy on drug donation. That particular minister reformed the Ministry of Health, did so much, and there's a document we call a document on donation of drugs.
Just a minute. Yeah. Those drugs were donated? That's what you're saying?
Well, yes, that's what I heard, that they were donated by a particular agency.
Manufacture that drug here?
We do. Some companies do. They do, and you know, it's a chemical that is brought in raw, which can be used, as I said, for many things. Okay. In a hand wash, in a paste, in a mouthwash, you know, and for so many things. And I did also tell you that a little of it can even be used to preserve some eye drop. So the issue is, it's a chemical that is brought in under regulation, and it can be used for so many things. So the issue is, we need to go back to the business and ensure things are properly done. They needed to be documented, and then we see the shelf life and labeled. But the issue of labeling is very paramount in drug usage. You could see two syrups, a shampoo and an emulsion that you should drink, having yellow color, both of them looking alike. Meanwhile, one is for external use, one for internal use. If you mistake them, you didn't label them, it can endanger life, like what has just happened. I think such a thing must have happened, but we couldn't even allow that to happen if the right personnel was allowed to be there to oversee those things before it gets to those mothers.
But perhaps the problem also could be the level of education of the user of the drug.
Yeah, but you see, education is an issue. Now, in Nigeria today, we have many signs to give a drug to a customer. We can use stroke, for external use, we put it in red label, external use. It will be labeled red. external use so that the mother sees something dangerous and it should not take by mouth. Sometimes we'll put some arrow, red arrow, not to be taken by mouth, you know. So, and some of these things, like I told you, chlorhexidine is quite a very powerful disinfectant and antiseptic agent. So it's not something you can, just like Tylenol, phenolic group, which they are very toxic, but you need to dilute them to a level that it can be used by human beings safe enough. Otherwise, it can cause some problem. So I think we need to do things right. I think that's the bottom line. And ensure that the personnel, the pharmacist must oversee those things before they are handed over to the mothers or the nurses who are going to give them to the mother, and properly labeled. Label is an issue in pharmacy, that if you don't label properly, something can go wrong. It can even wipe out a generation if you mislabel. So that you go and mislabel and acid as a syrup. Children will innocently take it, just as what has happened now.
So a patient has a
right. Education. It's not the issue of education. The issue is, who was there at the point when it was delivered to those mothers? Did a professional person, a man who should be in custody of those drugs, trained for 5 or 6 years in a university, was he there to oversee those things? I don't think that happened. I think I am here to be corrected.
Are you saying now emphatically that a patient has a right to ask for a label?
Yes. If a product is not labeled, it's an issue. In fact, there are some contractual agreement patients have with their pharmacists which they are not aware and they don't ask for it. I can't imagine in my practice, you come to pick a product and we don't tell you how to use that product. It's a disservice. It's part of what you want to give to that patient. It's part of your commitment when you graduated, when you train as a pharmacist, that you use what you are trained for to help life. It's the doctor to prescribe and you to vet and ensure the product is given accurately. That's the issue of drug. Correct usage. Now, if you say safe medicine, what is safe medicine when the right person is not there to give the drug? What is safe medicine when it's not labeled? I don't see anything there safe, where an acid can be taken by an individual and take by mouth. That's no safe medicine. So safe medicine means that the right drug must be given to the patient at the right time to the right patient. Not that because she used a particular drug for your headache, I should give to the next person. That's wrong. We do not know what would have caused that headache. So it's necessary for people to abide by simple instruction and ensure they demand from their pharmacist or pharmacy technician that, how am I supposed to use this product? Is their right? And if they don't do it, of course they have a right also to report to the regulatory bodies. We have regulatory bodies. Pharmacist Council of Nigeria is there. They have offices in all the states of the Federation, including Abuja. So you can call, there's a hotline you can call if you're not satisfied the way the pharmacists have given you your drugs. It is the duty of the pharmacist to ensure that that is properly done. And when there's no pharmacist, there's a technician who is also trained under the supervision of a pharmacist to give out such instruction.